Hello, my name is David Kazilian. I am a student doctor at SU. I will be doing the cranial nerves 1, 2, and 3.
Hi, my name is Tigran Dayans. I'm a student doctor at SCU. I will be doing cranial nerve 4, 5, and 6.
Hi, my name is Jonathan Trong, student doctor here at SCU. We're going to be doing cranial nerves 7, 8, and 9.
Hi, my name is Renny Shakurian. I'm a student chiropractor here at SCU. Today I'm going to be doing cranial nerves 10, 11, and 12.
Alright, so we're going to start with the cranial nerve 1 first, olfactory. It is responsible for scent. So I have a patient here. His name is Renny. Hello, Renny. I'm a student doctor at SCU. I'll be doing some exercises today with you.
Sure.
It's going to be required for you to take some deep breaths in, and you're going to be more or less telling me what you're smelling.
Sure.
Okay. So I'm going to have you take 3 deep breaths in and exhale. Perfect. So now what I'm going to have you do is close your eyes. Okay? So first item, you let me know what you're smelling.
Coffee.
Okay? Keep your eyes closed. Next item, going up to your nose right now. Let me know what you're smelling.
Peanut butter.
Beautiful, beautiful. Third item, going up to your nose, and you let me know what you smell.
Thyme.
Perfect. You gotta open your eyes. So you got everything correct. The olfactory is working perfectly.
Perfect.
So all in all, olfactory just controls the sense of smell. Alright, we're gonna be testing cranial nerve 2 and 3. It's my patient here, Tigran Dayans. Hello Tigran Dayans, my name is David Kazilian. I'm a student doctor at SCU. We'll be testing cranial nerve 2 and 3. Cranial nerve 2 is optic, so it controls vision. Cranial nerve 3 is ocular motor, which is eye movements. So what you're gonna do is you're gonna look straight for me. You're not gonna move your head at all, only your eyes. And you're gonna point at the color I told you to point at, okay? You ready?
Yeah.
Okay? Point at yellow. Blue, red, blue, yellow, yellow, blue, red. Okay, very good. You got all the colors correct. You pointed at it very perfectly. All right, so we continue the cranial nerve 2 and 3 tests. Exercise more like. We're gonna have Tigran here point at the object I tell him to point at, and then look back at me. All right, Tigran, so look at me. All right, now point at the time. Perfect. Look at me. Point at the coffee. Look at me. Point at the peanut butter. Look at me. Time. Peanut butter. Look at me. Look at me. Peanut butter. Look at me. Coffee. Perfect. You're all set.
Hi, my name is Tigran. I'm going to be testing cranial nerve 4, the trochlear. This cranial nerve involves eye movements mainly going down and inwards. Two ways to test this is have the patient look up to the ceiling with their eyes only and look down at the shaft of their nose. Could you please show me that? Look up to the ceiling, to your nose. Ceiling, nose. Ceiling, nose. Ceiling, nose. Okay. And that concludes the cranial nerve 4 exercise. So now I'm gonna do cranial nerve 5. This one involves motor and sensation to the face. For motor, I just want you to suck it in through the straw as small as you can, like a tiny hit. Stop, do it again. Just keep on doing it. Stop and go, stop and go. Again? Okay. Now for sensation, we're gonna be putting this on his face and he's gonna tell me if it's cold. So, do you feel it cold?
Yes.
And here too.
Yes.
What does this feel?
Not cold.
How about this?
Also not cold.
And that's cranial nerve number 5. Okay, I'm gonna be doing cranial nerve 6. This controls lateral movement of the eye. I like to call this exam the Old Spice exam. Basically, the patient's gonna be look at me, and then look at somewhere else, and then back at me. Are you ready? Okay. I want you to look at the window. Now back at me. To the mirror over there. Back at me. To the window. Back at me. The mirror. Back at me. Okay. And that concludes cranial nerve 6.
Hello, Tigran, student doctor at SU. We're going to be testing cranial nerve 7, which includes just like your facial nerve, different facial expressions, and some sensory. So what you're gonna do here, you're gonna close your eyes. My demonstrator right over here is just gonna make a random face, and Tigran right here is just gonna copy it once he opens his eyes. Are you ready?
Yeah.
Cool. Close your eyes for me. And then just make a face. Thank you. And then Tigran, please open your eyes and copy that face. Great. Now close your eyes and we're gonna do it again. Now open your eyes. Cool. And then last one, we're gonna close your eyes one more time and one last one. And open your eyes, Tigran. Great. Thank you. So that concludes facial expression of cranial nerve 7. Alright, so now we're going to be testing the sensory part of cranial nerve 7 facial nerve. What I'm going to be doing here, I'm just going to be tapping the side of his zygomatic arch, looking for any twitches, and that would indicate a lesion of cranial nerve 7. So can you do me a favor and close your eyes? Can you feel that?
Yeah.
Great. Can you feel that?
Yeah.
Great. So right here, I was looking for any twitches. This could indicate a lesion of cranial 7, and then he told me that he was able to feel it. So that means his facial nerve of his maxillary region is also working. And this Chopstick test was part of the cerebellum function test. Hi, ready? Your patient? My name is John, student doctor here at SCU. We're going to be doing a little bit of examination of your cranial nerve 8, which is your vestibulocochlear, which has to do with hearing and balance. So what I'm going to be doing is I'm going to be snapping on different sides of your body, and you're going to tell me which side you hear on, whether it's your right or your left. I'm also going to have you do it with your eyes open and closed at one point, just to test to see if your cerebellum is working properly. Is that all right? I'm also going to have you balance on one leg as well, just to, make it a little complicated. Cool, so with your eyes open, you're going to balance on one leg, and then I'm just going to snap. Right. Great, so then you do with your eyes open, now we're going to do with your eyes closed now. And the same thing, one leg, left, right, right, left. So he has a little unbalancing, which indicates a balance issue. He was able to tell which side was right and left, which indicates that his vestibulocochlear nerve is working correctly. Hello, David. Student doctor here at SCU. My name is John. We're going to be testing your glossopharyngeal nerve, which is cranial nerve 9. Has to do with swallowing, gag reflex, a couple other things. So what we're going to be doing here, I'm going to be putting some technique into a spoon, and he's just going to be eating it, swallowing it, mouth closed. All right? You ready for this?
Five minutes later. The next day.
This is taking a little longer than I thought it was going to take. All right. Now, here you go. Great. So, he was able to swallow it, very easily, and that will conclude the test of the glossopharyngeal.
Hi again, everyone. My name is Randy Shakurian, student doctor here at SU. For this next test, we're going to be testing the cranial nerve number 10 vagus nerve. For this test, I'm going to be having my patient here, Tigran, say a word. We chose to say sleeping bee. But what he's going to do is he's going to keep his mouth closed, and he's going to try to say the word while he's humming. That way we're testing cranial nerve 10. All right, Tigran, so for this one, you're just going to be closing your mouth, and you're basically going to try to say the word sleeping bee while your mouth is closed. You're pretty much going to be humming the word. Okay, so go ahead and say it. One more time. Perfect. Okay, so yeah, that concludes the test for cranial nerve 10, vagus nerve. So yeah. All right, for this next test, we're going to be checking cranial nerve 11, which is going to be the spinal accessory nerve, which is in charge of elevating the traps So for this next exercise, I'm going to advise Davi to do just a simple basic shoulder rolling exercise as such. So basically, Davi, what you're going to do is you're just going to basically do a couple shoulder rolls. We're going to go into a clockwise motion. You can slow down a little bit. Try to make sure that you're elevating your shoulders up. Perfect. And then we're going to be going counterclockwise. Slowly, perfect. Awesome. Okay, thank you. That concludes our cranial nerve 11 spinal accessory exercise. So continuing the spinal nerve cranial nerve 11 spinal accessory nerve, we're going to be doing the second exercise. For this one, David, you're just going to be holding your neck a little extended. Now you're going to be laterally flexing it to one side, and then you're going to be looking over here for me. Perfect. All right, we're going to be doing the same thing on the other side. So you're going to be laterally flexing towards your left. And then you're going to be looking here. Perfect. Okay, we're going to do that one more time. So go back into neutral position. Now go towards your right. And then you're going to rotate and look over here. Perfect. We're going to do that again one more time. So flex to the left. And then you're going to rotate your head. Perfect. So that tests the sternocleidomastoid muscle, which is a muscle also innervated by cranial nerve 11 spinal accessory. Alright, for the last test, we're going to be checking cranial nerve 12, which is going to be the hypoglossal nerve, which controls the motor action of the tongue. For this last test, I'm going to be telling my patient Jonathan here to stick out his tongue, and he's going to be moving his tongue from side to side. Okay, so Jonathan, go ahead and stick out your tongue for me, please. Okay, now you're going to be basically moving your tongue to the right and to the left. Okay, boom, boom, one more time, boom. Boom. Try to open your mouth and do it. There you go. All right. Boom, 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 boom. All right. And as you guys can see, Jonathan is able to move his tongue from one side to another. So you did great, which concludes our cranial nerve 12 hypoglossal nerve exercise. All right. So with that, it concludes our cranial nerve exercises. Thank you so much, Dr. Kodev, for watching. And yeah, that's that.
Like and subscribe.
Thank you.
Thank you.
Like, subscribe, and share.
So, cranial nerve 2.
It's fine, bro. Keep going.
Just keep going. Pause it.
Okay, perfect. Now just keep on doing that in repetition.
What's so close? Let's go.
Slowly.
You gotta see the eyes. You gotta see the eye movement.
This one involves motory and sensation feelings on the mouth and the face. Sorry, go again. Alright.
Hello, David. My name's John, student doctor here at SU. We're gonna be doing a little examination.